In this lecture, we will look at more of the components of blood pressure. The third component of blood pressure to look at is the TPR, or total peripheral resistance, or vascular resistance. This is the opposition of the vessels to the flow of blood. The first thing that can influence this is the size of the lumen. The smaller the lumen, the greater the pressure. You can see this when you place a nozzle on a garden hose or attempt to drink from the coffee stirring straws. The second thing is the blood viscosity. Viscosity is defined as the resistance to flow. To get an idea of how this affects flow, imagine drinking honey through a straw versus water through the straw. The more viscous the fluid, the more pressure is needed to move it. The third thing is the vessel length. As a kid, you probably tested this idea by taking several straws and connecting them so you could drink from a cup sitting on the floor. What you would have noticed is that you had to suck very hard to get any drink to come up the straw. Now, where this becomes amazing is for every pound of body fat we gain, we also gain about a half a mile to a mile in blood vessels. That means they are very small blood vessels with narrow lumens on top of having miles of vessels through our fat alone. In many cases, weight loss will lower a person's blood pressure because when the fat shrinks, the vessels are no longer needed and are broken down. Overall, blood pressure regulation occurs in the cardiovascular center of the medulla oblongata. Here we control heart rate, stroke volume, and negative feedback loops from neural and hormonal control. The higher brain also feeds into the negative feedback loop with information from the cerebral cortex, limbic system, and hypothalamus. We can actually increase the heart rate in anticipation of events and emotions. The mechanoreceptors provide feedback in monitoring joint movement and cause a rapid increase in heart rate at the onset of exercise or activity. The baroreceptors provide feedback of pressure change in the blood vessels. These tend to operate a little slowly. A person with orthopneal hypotension experiences lightheadedness and may faint upon rising quickly from lying down position. This is due to the baroreceptors not providing quick enough feedback to increase the blood pressure, maintaining the blood flow to the head. Without adequate blood flow, the person may have their vision go black or even faint. When they faint, they fall and go back into a lying position, and the blood flow can return to their head, allowing them to regain consciousness, but probably getting up a little slower the next time. The chemoreceptors monitor the levels of oxygen, carbon dioxide, and the hydrogen ion, and are closely tied in with respiration. This is monitored by the carotid and aortic bodies in the carotid artery and aorta. The vasomotor tone is at the base level of moderate state of contraction in the blood vessels. By starting with a moderate state of contraction, it allows fluctuation in either direction. One of the reasons it is thought there is so much hypertension in our society is the increased level of contraction from spending more time in a sympathetic state. We will start looking at how the hormones can also affect blood pressure. The first set of hormones is the renin-angiotensin-aldosterone system, or RAA system. The kidneys do the filtering of the blood and detect a decrease in blood flow. In response, the kidney secretes renin into the bloodstream, which combines with ACE, or angiotensin-converting enzyme. This activates the angiotensinogen already in the bloodstream to become angiotensin 1 and then angiotensin 2. This increases the tension in the vessels, or vasoconstriction, and increases blood pressure. This also triggers the secretion of aldosterone, which will increase sodium reabsorption by the kidneys. Wherever you move sodium in the body, water will follow. So this will increase the total blood volume and increase the blood pressure. This is why the kidney disease must always be considered and evaluated in a person with hypertension, because it may be the first sign something is wrong. Epinephrine and norepinephrine are the hormones released from the adrenal gland when there is an increase in sympathetic stimulation. This will increase the cardiac output by increasing both the contraction force and the heart rate. It will also increase vasoconstriction of the vessels to the abdominal organs and increase the blood pressure. ADH, or antidiuretic hormone, is also known as vasopressin. A diuretic is a substance which causes the kidneys to secrete more water, so an antidiuretic will cause the retention of water. When there is a decrease in blood volume, ADH will be produced in the hypothalamus and secreted from the posterior pituitary. This will tell the blood vessels to vasoconstrict, as well as the kidneys to conserve water, and the skin to decrease sweating to increase blood pressure. Atrial natriuretic peptide is released by the atria of the heart to trigger vasodilation and promote the loss of sodium. With the loss of sodium, there will be a loss of water to decrease the blood volume and decrease blood pressure. Because there are times when it is appropriate and necessary for our blood pressure to be high, this does not kick in until the blood pressure is very high to still allow normal increases for daily life. This is secreted to prevent the aorta and walls of the heart from being damaged by extremely high pressure. One category of blood pressure medications is the diuretics. These cause the kidneys to let more water pass into the urine and also dilate the blood vessels to decrease the blood pressure. These are often prescribed in conjunction with potassium supplements, since potassium levels are often decreased with the excess fluid secretion. Muscle cramping is commonly seen, especially when patients are not compliant with the potassium supplements. The beta blockers or beta adrenergic receptors block the sympathetic stimulation to the heart and blood vessels, preventing the heart from beating harder and causing the vessels to dilate, decreasing blood pressure. Calcium channel blockers interfere with the flow of calcium needed for muscle contraction. These can decrease the contraction of the heart or blood vessels, or both. This results in a decrease in blood pressure. The ACE inhibitors stop the action of the ACE enzymes, preventing the formation of angiotensin. This leads to vasodilation and also blocks the action of the kidneys to decrease blood pressure. The vasodilators expand the blood vessels to decrease blood pressure. There are other categories of blood pressure medications, and this is not meant to be a comprehensive list. You may also find subcategories to these medications. This was just intended to be an overview of how the medications will affect the hormone levels. The pulse is used to measure the contractions of the heart per minute and is therefore measured in beats per minute or BPM. When taking blood pressure, the first number determined is the systolic pressure, or the pressure during the contraction of the heart. This is determined by what level of pressure does it take to completely occlude blood flow in a vessel. The sound, or bruit, is created by the start of blood flowing back through the vessel as the pressure in the cup is released. The diastolic pressure measures the pressure while the heart is relaxing. The pressure in the cup slows and is decreased further, and then we listen for the bruit to disappear, indicating that there is no further interruption of blood flow. When taking blood pressure, it is important to inflate the cuff enough to make sure you completely occlude blood flow and listen to the end, because there may be windows where the sounds are not heard. Average blood pressure is 120/80 millimeters of mercury, while hypotension is below 90/60 millimeters of mercury, and hypertension is over 140/90 millimeters of mercury. Frequently, blood pressure is treated pharmaceutically prior to reaching 140/90 millimeters of mercury, as we are moving towards a system of grading blood pressure. Early stages of hypertension are being diagnosed or at least monitored as low as 130/80 millimeters of mercury. The general path of blood flow through the heart, body, and lungs starts in the right ventricle, where it is carried through the pulmonary trunk and arteries to the lungs. Here the blood picks up oxygen and returns to the heart through the pulmonary vein and enters the left atria. Next, the blood moves to the left ventricle, where it exits into the aorta and is carried to the various parts of the body. It finally returns to the heart through the superior and inferior vena cava and enters the right atria and back into the right ventricle. Typically, blood is carried to one organ or muscle and then returned to the heart. for oxygenation in the lungs. In the hepatic portal circulation, the blood from the intestines will pick up substances from our food, such as nutrients and toxins, and take it to the liver before returning to the heart. This allows the liver to process the nutrients and toxins before sending them back to the heart and general circulation. Most nutrients will enter this way, but the large dietary fats we consume are actually absorbed into the lacteals, into the lymph, and bypass the hepatic portal circulation. This does not join the general circulation again until the materials are brought back to the heart. In the fetal circulation, the flow from the right ventricle is diverted to the left ventricle via the foramen ovale. This allows blood flow to bypass the lungs prior to birth, as the baby receives oxygen from the umbilical cord at this point. Atherosclerosis is hardening and plaquing of the arteries. This is a result of fatty plaques building up in the vessels. Arteriosclerosis involves calcification of the arteries. Atherosclerosis is so extremely common in the U.S. that most children already have signs of atherosclerosis by age 10. There are some current studies being conducted on the effects of nitric oxide on expanding the blood vessels and using L-arginine to help improve blood flow and potentially reverse plaques.